Surgical site infections, or SSIs, account for 31% of hospital-acquired infections in hospitalized patients. These infections lead to prolonged hospitalization, complications with healing, and possible death. Furthermore, the hospital is not reimbursed for hospital-acquired infections.
What is a surgical site infection? A surgical site infection is an infection within 30 days of surgery related to the incision site. There are many different risk factors when talking about surgical and site infections, which include hypertension, diabetes, heart disease, smoking, drinking, steroidal injection, and abnormalities in blood work, white blood cells, red blood cells, hemoglobin, total protein, albumin, CRP, and ESR.
Can you imagine going in for a cabbage only to receive a prolonged hospital stay due to a surgical site infection?
The doctor and the nurse meet to review the patient's file before preparing for surgery.
Let's review our patient's file before preparing for surgery. I have Mrs. Smith scheduled for a cabbage today. She's a 55-year-old female that has a history of smoking, obesity, type 2 diabetes, hypertension, bladder stones, and a cholecystectomy in 2009. She denies alcohol and illicit drug use.
Well, looking at her lab work, it looks like her glucose is elevated and her total protein and albumin are low. And she has a BMI of 28 and reports that she didn't stop smoking prior to surgery. So I will consult the dietitian and discuss our findings with her.
Okay.
So why is it important to be aware of the risk factors your patient has at getting a surgical site infection? A study we researched aimed at identifying the risk factors for readmission to the hospital within 30 days after receiving a lower extremity vascular procedure due to an infectious complication following the surgery. There were 7,089 patients in the study, and of those patients, 289 were readmitted within 30 days due to a hospital-acquired infection. 14.8% of the 289 patients readmitted were then diagnosed with an SSI. The nurse discusses the information with the patient.
Hi, Mrs. Smith. I'm Cody, and I'm going to be your nurse today.
Hello.
And we're going to talk about your upcoming surgery. So the doctor and I just had a conference about your blood work and pre-surgery status to evaluate your readiness for surgery. It appears that your lab values indicate that your diabetes is not currently controlled and that you are malnourished. I'm also concerned that you did not stop smoking prior to surgery.
I mean, I forget to take my insulin sometimes, and if I'm too tired after work, I'll just go grab something to eat. But I'm confused what this has to do with my surgery. My surgery's on my heart.
Well, patients who are malnourished or have uncontrolled diabetes and smoke have a higher risk of surgical site infections or SSIs. Our goal is to reduce that number by ensuring that when possible, we can make our patients as ready for surgery as they can possibly be.
So I have to quit smoking for 6 weeks, take my insulin regularly, and then follow the dietitian's plan for me in order to have my surgery.
Yes, ma'am. That will give you the best chance of avoiding a surgical site infection.
So Mrs. Smith will come back to the hospital after she has followed her pre-surgery healthcare plan. With controlled diabetes, improved nutritional status, and cessation of smoking, she has reduced her risk for an SSI significantly. Hospitals benefit from implementing policies that screen patients for SSI risk and reduce those factors as best as possible. By rescheduling elective and semi-elective surgeries for optimal times, the hospital will see the maximum return of service.
What we recommend to help decrease the risk of surgical site infections. Practices that are currently being implemented in hospitals today include prophylactic antibiotic use for at-risk patients because gram-negative organisms have been found to be the most common cause of surgical site infections, hair removal outside of the OR because hair harbors bacteria and other infectious organisms that can contaminate the surgical site, chlorhexidine scrubs used prophylactically because it's useful in removing opportunistic skin-dwelling organisms that cause infection when exposed to an open surgical site, cessation of smoking 6 weeks prior to surgery for optimal outcomes. What we recommend improving includes nutritional status and diabetes control before surgery to allow for optimal healing following an elective or semi-elective surgery by evaluating their blood work. We can measure this by developing a protocol that analyzes the readiness of a patient for surgery. and if a certain standard is not met, then the surgery will be delayed until the criteria is met in order to avoid a surgical site infection.